In home health settings, the goal is to assess, monitor, and manage cardiopulmonary health effectively while promoting patient comfort and compliance with care plans. Frequent assessments, open communication with patients, and collaboration with healthcare teams are essential for delivering comprehensive cardiopulmonary care in a home health setting. Cardiopulmonary assessment is crucial for monitoring the health of patients with cardiovascular and respiratory conditions, as well as for preventive care. In this video, we'll go over the must-have steps for a thorough cardiopulmonary assessment, tips to streamline your assessment while keeping it patient-centered. I'll share some practical tips to make your assessments quicker, easier, and more accurate. Let's get into it. Medical history. Collect information about the patient's past and current medical history, including any cardiovascular conditions, surgeries, or interventions. Collect information on the patient's respiratory history, including any chronic respiratory conditions, e.g., COPD, asthma, bronchitis, emphysema, etc., previous respiratory infections, and relevant surgeries. Inquire about current respiratory symptoms such as cough, shortness of breath, wheezing, chest pain, or changes in sputum production. Inquire about influenza, pneumococcal, and COVID-19 immunizations, when and where received. Note down any adverse effects of and contraindications to the vaccines, such as severe or life-threatening allergy to a prior dose or due to age or illness. Document if vaccines offered but patient declined. Assess the severity and frequency of symptoms. Inquire about risk factors such as smoking, family history of cardiovascular diseases, and lifestyle factors. Measure and monitor vital signs regularly. This includes assessing the patient's heart rate, blood pressure, respiratory rate, temperature, O2 sat. Fluctuations in vital signs may indicate changes in the cardiovascular status of the patient. Changes in respiratory rate or the presence of respiratory distress can be indicative of respiratory issues. Measure oxygen saturation using pulse oximetry to assess the adequacy of oxygenation. Monitor for oxygen desaturation, especially during activity or rest. For patients with asthma or other obstructive airway diseases, assess peak expiratory flow regularly to monitor changes in airflow limitation. Weigh patients ordered to be weighed. CHF, dialysis, failure to thrive patients often have orders in place to be weighed. Measure ankle circumference for patients unable to bear weight. Check for signs of heart failure, such as edema in the lower extremities, jugular venous distension, and auscultate for abnormal heart sounds. Assess rate and depth of breathing, dyspnea, shortness of breath, angina, cyanosis, and palpitations. Assess neck for distension, engorgement. Assess peripheral pulse and capillary refill of nail beds. If patient is on anticoagulant therapy, assess for abnormal bleeding, bruising, and petechiae. Do PT-INR if ordered. Assess effectiveness and compliance with medications such as Coumadin. Conduct a thorough respiratory examination including inspection, palpation, percussion, and auscultation of the chest. If lungs are clear in all lobes, then make note of that. If they are abnormal, document location and quality, wheezing, rales, coarse, etc. If the patient was wheezing and does nebulizer treatments and the wheezing clears out, document that. If a patient sounds coarse, ask them to cough and take a deep breath to mobilize lung secretions and then recheck. Document if you had to do the above pulmonary toilet. Evaluate the patient's overall respiratory effort, use of accessory muscles, and any signs of respiratory distress. Inquire about any cardiovascular symptoms such as chest pain, shortness of breath, fatigue, or dizziness. Monitor for changes in symptoms and their severity. Assess type and severity of cough and amount of sputum, color, and consistency. If your patient has a trach, document that, along with the size. Document any type of care given, such as use of normal saline to loosen secretions as ordered, suctioning done, how many times, how tolerated, consistency, amount and color, skin integrity around trach site, size of the tube, cuffed or not cuffed. For pneumonia, indicate type of pneumonia and causative organism if known. Example, viral, bacterial, COVID pneumonia. For COPD, indicate if acute on chronic, or chronic if known. If a patient has an AV fistula for dialysis, document the location and presence of thrill and bruit. If they have an AV graft for dialysis, a portacath, or Quinton cath for dialysis, document its location. Review the patient's medications to ensure they are taking them as prescribed. Monitor for potential side effects or interactions that may impact cardiopulmonary health. Ensure proper usage and adherence to the prescribed regimen. If the patient uses oxygen, document when the oxygen is in use. Is it QHS? Is it PRN, shortness of breath? Is it intermittent or continuous? Document the liter flow rate and the method of delivery. For example, patient is on oxygen at 2 liters per nasal cannula QHS as needed for shortness of breath. Document if the patient uses nebulizer treatments or handheld inhalers and the reason why. Check for backup plans in case of a power outage. Instruct on oxygen safety precautions. Evaluate the patient's diet and exercise habits, as these play a crucial role in cardiovascular health. Provide guidance on maintaining a heart-healthy diet and incorporating appropriate physical activity. Evaluate the patient's ability to perform daily activities and exercise. Provide guidance on energy conservation techniques and breathing exercises to improve respiratory function. Assess the home environment for potential respiratory irritants, such as smoke, dust, allergens, or pollutants. Provide recommendations for minimizing exposure to these triggers. If the patient is on home ventilation, assess the functionality of equipment, including oxygen concentrators, nebulizers, and ventilators, need for filter changes, assess humidification canisters, tubings for molding, residue, etc. Educate the patient and their caregivers about their cardiovascular condition, medications, and lifestyle modifications. Educate the patient and caregivers on the management of respiratory conditions, proper inhaler techniques, and recognizing early signs of exacerbations. Provide information on recognizing and responding to signs of deterioration or emergencies, and when to seek medical attention. Communicate regularly with other healthcare providers involved in the patient's care, such as cardiologists, pulmonologists, respiratory therapists, nurses, etc. Thanks for watching. For more videos like this, be sure to subscribe. If this video was helpful, hit the like button. It helps others find it too. If you're looking for helpful, downloadable digital resources on home health management, visit my Etsy shop. Link provided below. For questions and insights, drop a comment, and if you know someone who could benefit from this video, feel free to share. See you in the next one.